It's perhaps one of the most controversial aspects of the entire lockdown. Your right to see a GP.
So from now on, all consultations should be teleconsultations unless there's a compelling clinical reason not to. Of course, if there's an emergency, the NHS will be ready and waiting to see you in person, just as it always has been.
Well, he says that. Today we learn that doctors have been told to discourage patient appointments in person to promote the use of virtual consultations. What does this mean for the future of healthcare in this country? And have you managed to see your GP? Details on the way. Also this afternoon. It is, of course, more violence in Gaza. This is a pretty grim picture emerging there. It isn't getting any better. But what are the facts here? What is this dispute over? And ultimately, who is responsible? We'll have the latest on that. And this.
When the sergeant comes to you, state your number, rank and name.
225-29648, Private Harkin, sir!
The next time you turn up on my parade with sleep in your left eye, the corner of, you will be marched off this parade into jail. In fact, you will now be marched off this parade. Get this man locked up, get him beasted, get him sorted. He is a mess.
Beasted or basted? That's what the armed forces is meant to sound like. No messing. Today we learn of a very different picture. Soldiers are now complaining about a lack of options of vegan food and even moaning because their military boots are made of leather. Yeah, I'm sure plastic shoes go down a treat when navigating broken rocks in the hills of Basra. We'll have more on that a little later as well. 0344 499 1000.
Ian Collins, weekday afternoons from 1 on Talk Radio.
Have you managed during this pandemic to see your GP? What a crazy question. There's a litany of really unfathomable, crazy questions we've had to ask in the last year. Have you managed to hug your mum? Have you had the opportunity to even see a friend? Was it possible you could go for a walk? Man alive. This is the latest. Have you managed to see your GP? I mean, it's been many years since the family doctor would show up at the house. It was like the family doctor showing up at the house was like waiting for royalty when you heard the click of the car door go and your mum would say, I think that's him. And in would walk the family GP, usually suited and carrying that all-important bag of medical tricks. A few short words from the doctor and the bag was open. Out came the stethoscope, usually followed by that little torch. You could have a little gander in your throat and your lug holes and see what was going on. Mum or dad standing by as he carried out, our medical hero carried out his medical analysis. I think he's probably got a sickness bug, the doctor would say. Let him have some rest, give him plenty of water. It'll be gone in 24 hours. The house-to-house doctor inquiry, of course, disappeared years ago. I'm sure there are maybe some exceptions where that is the case. Maybe privately you can probably get somebody to pitch up at yours. You certainly wouldn't get the doctor around to your house today if your kid had a fever or you had a thumping headache. Things change, things move on. In future, they said, you would go to them, they wouldn't come to you. Okay, fair enough, I get it. Today, however, we learn that you're not even going to go to them. Doctors have been told to discourage patient appointments in person to promote the use of virtual consultations. These are new NHS guidelines instructing family GPs to embed a system of total triage, I'm quoting there, meaning that anybody seeking to see their doctor must first have a discussion online or on the telephone. It makes clear that anyone deemed by a doctor to require face-to-face consultation could still receive one, but it says about a third of all patients' requests can be dealt with using some kind of online or digital mechanism. The advice was first issued, actually, last April, last year, and updated again in September. As a short-term measure, it's now been formalised into annual NHS operational planning guidance, which came into force last month. That, everybody, is the future of the health service. If you go to see a GP, if you get to see a GP, you're one of the lucky ones. Is it a raffle, like a lottery? Have I been selected this month to go and see the GP face to face? I mean, after all, that would kind of make sense. A lot of what a GP is dealing with is there's a visual component to quite a lot of analysis, whether it's a rash or a bump or a lump or a sickness, a pallor, a certain look or disposition, sure, phones are all right, but if you're zooming in on an old Nokia 360, yes, I know they wouldn't work for that, but you take my point, then what kind of image is the doc at the other end going to see? If your lighting's a bit bad, you could look dead on the other end of the phone. If your lighting's a bit good, you might look fine and dandy or anything but. 0344 499 1000. This is... And I honestly think of all the different things, and I'll explain why. This is one of the worst upshots of COVID. I know there's an argument to say it was kind of going this way anyway. It was a lot harder to see a GP. They were doing far more telephone responses, and this isn't completely new or because of COVID, but COVID, like so many other things, has accelerated this system, and it makes it the new normal. But of all the things, I think this one is the one that we should really put in the box and mark outrageous. This goes right into the face of everything or flies right in the face of everything a civilized society should be. And that is the right to make a phone call and go and see a doctor. A face-to-face consultation with your doctor. I can just about cope with this as a patient. I could cope with that, and I know some people don't like sitting in waiting rooms. I hate it, and it can take a chunk of your day away. And if I had, a need for a renewed prescription, or I was feeling something that I thought was clearly not going to be too bothersome to a doctor, yeah, ringing it in might be okay. I think that's the exception. I don't think that is the rule. And when you consider the age range of people, I'm thinking of kids to begin with. Little kids. I know you get panicked parents who are, almost have got their GP on speed dial because they're ringing them so often with another problem because baby Tabitha has thrown up again. Yeah, that's what babies do. I understand that. But I'm thinking of the older age groups as well. We're going to see a GP has kind of more than one reason. I think older age groups need that's not to patronize anybody who just happens to be older. But I think there is a kind of, that the face-to-face thing, I think, carries with it a level of reassurance. And phoning in digitally, doing a Zoom call, text me my diagnosis, get in the bin. This is the 21st century. And we are now not considering, but implementing a rule where it will be the last point of call, unless you happen to be dying or your leg's falling off or something outrageous. You've gone all kind of exorcist around the place and your head's on the spin and you're vomiting goo over the living room, then yeah, you might find yourself getting an appointment down at the Quacks. But beyond that, think of your phone, think of your laptop, your computer or your iPad to see your GP. It's impersonal. I don't think it's very effective, and I'll come back to that, but it's impersonal. And I think that the seeing of the GP is as important as what the GP says, right? I hope that's reasonable. I think just speaking to the doctor, where you have there's a whole different way in which you conduct yourself when you are one-to-one and face-to-face. I think the doctor would get a far more accurate set of symptoms from you face-to-face, and of course they can examine you. One of the first things that happens when you go into a doctor, regardless of what's wrong with you, they whip out the old aforementioned stethoscope. They'll check your heart. They'll do it round the back, check for a few other bits and pieces in your bronchial system, make sure respiratory stuff is ticking along rather nicely. They might do your blood pressure as well. You're not going to do that on a Zoom call, are you? You're not going to do that via text. The last time I looked, the old Apple Watches are going on leaps and bounds in terms of health, but they're not quite there yet. So you sort of need all of that. But actually the civility, what it says about the world we live in, what it says about older people, the need for that consultation. And you get into those dialogues with doctors, and actually, as the conversation unfolds, it becomes apparent that you can far better describe what is going on. You might have a set of symptoms, and then as you begin to talk about it face to face, you oh yeah, there's also that. I don't think you get that same thing on a Zoom call or via a text messaging service. Text in your symptoms and we'll text you back with what we think is going wrong. It's a GP, not flipping Google. What is going on over there? We're usually told not to do that. Don't check your stuff on Google because you'll discover you are dying whatever you press. A friend of mine had a situation. He had a lump on his leg and thought, this is, it's not right. There shouldn't be a lump on the leg. you know, calls the doctor thinking, well, if you've got a lump on your leg, how many ads are there? If you've got a lump in a place where there shouldn't be a lump, then, you know, straight away go see your GP. It goes to the GP, calls the GP. They say, sorry, the computer says, no, we can't come and see us. But you can send a photo of your lump if you like. Are you serious? Send a photo of a lump? I mean, the last time I looked, I'm no lumpologist, but I know that, you know, generally feeling the lump gives you a far more accurate medical idea from a clinical perspective, would be the kind of starting point. And long story short, on this goes, the doctor says, no, you know, maybe nothing to see here. Then eventually ends up when it's got worse and phones back, ends up going to see another specialist, all manner of scans take place, and it culminates in the worst news possible. The worst news that this is something potentially really, really serious and, you know, life-changingly or life-endingly serious. That's how it could have been. And that then meant going to another specialist who was able to fully ascertain, well, it could be that, but actually I don't think it is. Oh, look, there's a scintilla of light. I'm not dying after all. Fantastic. All because of the lump in the leg. This is 13 weeks this goes on for. 13 weeks. And eventually they go, do you know what? No, it's fine. It's just an abnormality, but there's nothing to see here. There's nothing wrong. You're fine. Get on with your life. It just happens. You know, a bit of old gristle or whatever it happens to be. That could have been, and was told at the very end, if you'd seen a GP to begin with, we could have ascertained that to start with. How many of those? Matt Hancock said in that clip, do you know what? We can sort this out. If you're serious, we'll see you. But how many of those will fall through the cracks? I wonder. When was the last time you managed to see your GP? Think of lockdown. Think of where we've been. Did you manage to get that all-important appointment?